The following program was produced by PAC TV in accordance with the agreements PAC TV has with the towns we serve. The content of this program does not reflect the views or opinions of the PAC TV staff or board of directors.
Welcome to Healthy Kingston. My name is Janet Wade. This program will be devoted primarily to the pandemic and what the town is doing, and particularly the Board of Health, to handle it. And as all of us as residents can do to keep the numbers low. I did receive some information from the health agent that I want to share with all of you, and that is we receive weekly reports from the Massachusetts Department of Public Health as to the cases of COVID in the state. And we automatically publicize those on our website every Thursday morning when we receive them. Those are the legitimate numbers that we get from the state. As far as anything daily, we currently have a nurse who's employed to run the Maven program, which is a program that's been produced by the Department of Public Health to look at individual towns and the diseases that they have going on in the town. And that will be helping us with tracking any cases that are in the interim between the weeks. Alrighty, I'd like to introduce Heidi Whipple. Heidi is a member of the Board of Health in Kingston. She's also a registered nurse and is a case manager at Beth Israel Deaconess Hospital in Plymouth. So Heidi, thank you very much for being with us here. And I wanted to ask you, during this time of the pandemic, what is the difference between influenza and COVID-19?
Thank you for having me, Janet. The difference between COVID-19 and influenza is actually the virus itself. It presents in the same and similar fashions, as they're both respiratory illnesses with fevers and body aches associated. So the true difference is it's two different viruses. We have the influenza virus and the COVID virus.
Why is it so important for people to get the flu vaccine right now during the pandemic?
So the real push for the flu vaccine is to decrease our caseload of the flu and reduce the stress on the hospital so we're able to care for those COVID patients, leaving ICU beds that would have otherwise been taken by influenza patients open for our COVID patients.
Okay. There's been a lot of discussion about people with pre-existing conditions not being exposed to COVID-19 or the flu for that matter. Can you speak to some of the most important pre-existing illnesses that are out there and what people need to be looking for?
I can. I'd like to say that anyone who is undergoing therapy for cancer because of the immunodeficiency it causes, chronic kidney disease, COPD, asthma, heart conditions such as congestive heart failure, coronary artery disease, or cardiomyopathies, your organ transplant patients who are on immunosuppressant drugs, obesity. If your BMI is greater than 30, you're going to have issues with COVID, sickle cell disease, smoking, type 2 diabetes. So a lot of these people will present as you would think would be okay, but really these even just minor underlying conditions are going to cause a large issue for them if they contract COVID.
What about children and teenagers? What type of activities or pre-existing conditions can predispose them to getting the virus?
Activities that might put them at risk are going to be a lack of wearing of masks, a lack of hand washing, being in close contact with people that are not within your family unit or your bubble, so that you have an exposure for greater than 15 minutes, even with a mask on. If they're not within your family unit, you shouldn't be within 6 feet of them for that prolonged period of time.
Okay. And certainly young people and children with some of the illnesses that you mentioned earlier, asthma, sickle cell disease, people with, kids who have heart problems, kidney problems.
Asthma, respiratory illnesses, kids that, even your asthmatics and your kids with allergies are going to be at higher risk.
Absolutely.
Because of their immune response. We do have a childhood obesity issue. And obesity across the board is an issue when it comes to COVID-19. It makes people predisposed to being very sick from the illness.
Right. Another thing that is starting to get more press is vaping. Teenagers and kids in middle school vaping. Again, they're predisposed to lung problems, and that's going to make them all that much more less resistant to COVID if they're exposed to it. So vaping is a real issue as well, and should not be conducted during the pandemic, if at all.
You know what? Vaping, smoking, anything that is in your lungs that is artificial is going to cause stress on your lungs. And if you then contract COVID-19, your lungs are less able to respond and heal as quickly, because there is pre-existing damage to those lungs, making the recovery harder.
Right. So this would be a review for all of us, but I know the holidays are coming up, certainly Thanksgiving. The CDC has already instructed people that we should limit our social circle to those that are in our immediate family or who have been in our bubble. Actually, they had mentioned at like Thanksgiving meals, no more than 10 people. But what would you say would be some good takeaways for people who are planning holiday gatherings?
I concur within your bubble. Stay within the people that are around you every day to try and decrease those factors. On the table and join each other virtually so that they're still a part of the conversation. You're keeping your family members safe. You might be saving that grandparent from the possibility of contracting COVID.
Right, good point. I know what I've also heard is the forget buffets. And if there should be like one designated person who like gives out the turkey, another designated person who distributes the mashed potatoes, whatever it might be. So there is not multiple dipping and exposure by other people into the food that you're going to be serving. And also that there be one person who is kind of like the marshal over the dinner. So to let everybody know, these are the rules instructions we're putting in place before the dinner so that everybody's on the same page and no one will feel uncomfortable, such as what you were talking about, wearing masks, using hand sanitizer, socially distancing, this type of thing. Is there anything else that you would like to add to the conversation?
I would like to remind people to please wear your mask correctly. I am amazed at the times I go around town and I see this. This mask wearing does nothing for anybody. It's about as useful as this one or this one. So please, when you wear your mask, wear it over your nose, covering your mouth. Put it on, leave it on, don't be touching it. It's not, you need to consider the outside of the mask dirty at all times. And when you go to take it off from your ear loops, fold it into itself, and either dispose of it or put it into the washing machine, whichever type of mask you choose to wear.
Excellent advice.
The rule at our house is we treat it like underpants. You
Mhm.
wear one a day or more if needed, but you don't wear them more than one day per mask.
Uh-huh. Okay. Good advice. Very good advice. Right. So you don't keep the same one in your car and just use it perpetually.
No, please.
Right. Right. So, all right. Well, Heidi, thank you very much. Words of wisdom from a nurse and a mom and a community member. So thank you so much. And hopefully everyone will stay safe and be healthy during this.
Thank you for having me, Janet, and happy Thanksgiving to everyone.
Next, I have the pleasure of introducing Dominique Lounge. Dominique is the registered nurse, and she is working with our health department to help track infectious disease here in the town of Kingston. So if you would, Dominique, welcome, and please tell us a little bit about your background.
Hi, so I'm a nurse by trade for many years, 22 years. I've done a whole bunch of different things. I was an ER nurse. I was a public health nurse for Holbrook. And so I have a good understanding of how a public health nurse works. I currently work at Blue Cross Blue Shield of Massachusetts. And at this point, I'm pretty much doing both jobs, this one part-time and the other one full-time.
Would you please tell us about the Maven system that you've been trained in and you're working on that's tracking diseases?
Yes, so the Maven system is the CDC's reporting site. So it does report and record all COVID-19 cases. We are also tracking right now TB cases, Lyme's disease, flu, all of that gets entered. Anything that's communicable, in other words, can be out in the community and transmitted. But obviously right now we're focusing on COVID the most.
Right. And I know there's been a concern as to how often the cases are updated. Can you speak to the residents and give them a better idea as to how often the numbers will be updated? Up until now, it's been weekly. We've been getting reports from the state.
Well, hoping to be up and running this weekend after doing all the training I needed to for Maven. And I plan to put out a daily count once I get that going. There hasn't been anyone consistently in the Maven website to do this. So that's why I can do this every day and check in, and maybe we can set a time when I post the most, recent numbers.
Wonderful. And that would then be the week of the 9th of November that we're looking at.
Yes.
View of the taping that we're doing now. Well, that will be wonderful. I'm sure it will allay a lot of fears and let people know exactly where we stand. And hopefully in the future, those numbers will be starting to go down.
Yes.
And you do trace those people, correct?
Yes, myself, and they also have a contact tracing unit that helps out because the towns could never keep up with it all.
Right. So we'll know who those people are, where they are they getting the help that they need?
Exactly.
That type of thing. So they're just not a number. They are definitely being tracked and their issues addressed. Okay.
Yes.
Well, thank you so much. We definitely appreciate you. You're pivotal to what's going on now in the town. So good luck, and we'll be keeping you in the loop with future programs.
Okay, great. And thank you so much for having me.
Absolutely. Take care. Bye-bye. All right. We need a shiny face. It's great to see Sue Woodworth. We need some positive news here. Sue Woodworth, who we all know as Director of the Recreation Department here in Kingston, please let us know what's going on in town that people can be taking advantage of during this crazy time.
Sure. So we were fortunate enough to open up a little bit in the summertime. I won't go backwards too far, but it was a great opportunity to get some of our families together and our kids together. So it was exciting. It worked out really well, and much smaller capacity, and everything was held outside, but we had a phenomenal summer considering what we were going through. So it was nice to see all those smiling faces. And then we were able to open up in the beginning of October. for some additional programming and some indoor programming, which we had not done yet. So it was nice to, again, have that opportunity this past month to kind of get underway. We were waiting for the state directives, as we all do. And once those came together, we worked with our town's task force team, which has been great. It's a lot of different resources in our community to work together, from our Board of Health to our fire department, our facilities department, our administration. So it's a great collaborative effort to make sure we're continuing to do the right thing and get us all back to where we can be in some capacity. So we did do that this particular October, and we were able to offer quite a few programs inside, and they were all very successful. The numbers are much smaller, obviously, but we took all the protocols in place with the wearing of face masks, the sanitization, and all that good stuff. But the programs consisted of, we had one program that was for school-age children. It started out as a program that we were going to offer as both the social and academic support, and it kind of morphed into more of the social and the play aspect. The academic piece, the kids weren't as interested in, which, as you can imagine. So it was great with the great fall weather we had. We did that outside most of the time and had a few indoor activities. We hope to do that again, maybe late fall, sometime in the winter, when we have some more of our college students that might be home on some break and can help us out as well. So that was a fantastic program. We have some other programs that we were able to start. We normally have a year-round dance program, so we've started that in some capacity. Again, much smaller numbers of kids, but they have been great. Our teacher is fantastic, and she just loves what she does. And so there's that one that just started in November, and hopefully will continue on in December. We started up our theater production program. So unfortunately, they're not able to do a full production like we normally do, but they are doing, 4-week, we're doing everything kind of in 2 and 4 week segments, just because of the unknown and the uncertainty of things. However, it's been an exciting opportunity again to have them come back. So they're doing workshops for kids as young as 4 years old, and then up to about eighth grade. So they came back again in October. They started up another segment in November. We're also doing some programs coming up soon in this month, Babysitter Safety Training Program, which is a great opportunity for right now, as well as a Home Alone and Staying Safe program that we've done in years past. But that one's really important, I think, right now in today's world. So we're excited to offer that. We also started up music lessons with Mr. George Vento, who was one of our Kingston Intermediate School music teachers, and he's doing some online kind of one-on-one lessons at this point. So you can check out our website, which is kingstonrec.com. And that is actually offered for adults and children, which is great. He's offering ukulele classes. And if you don't have your own ukulele, our library, which is fantastic, and are operating in what capacity they can at this time, has a library of things, and they have ukuleles that you can actually check out and participate in that program. So that will be fun. We are also doing a nutrition bingo that we just started. Janet, haven't had an opportunity to tell you that, so I'm not sure all the details on that, but we'll be doing an online nutrition bingo program, so that will be good for the kids. We're also doing some adult program. We have a pickleball back to play program. So they've come inside, again, limited numbers, but it's been great to see their faces. We're also doing a pickleball learn to play program. So it seems like it's a great sport that so many of our residents and the local communities are participating in. So it's fun to have that option as well. Some other things we are doing for the fall. Let's see, I just want to check my list, make sure I don't forget anything. We're doing some tennis programs. We collaborate with some of our local businesses, which is always nice to work with them. So we work with the Kingsbury Club, and they're doing some tennis programs for our teens at this time. And we also have some art programs that we're working on, and one in particular is for more of a toddler. So it's a story time and a paint opportunity for ceramics with a local vendor called Clay Chick is the name of their company. So we've got a lot of those great things going. And as always, we have a phenomenal number of outdoor activities and outdoor spaces here in our community. Grays Beach Park is open, and it's been open since back in May. The Opachinski Athletic Complex, we've been able to have some of our sports organizations participate in that complex will be open for, you know, continued use as far as the weather holds out. Our sports organizations are narrowing down. Soccer has their last weekend this weekend, and they've been phenomenal again, just kind of following all of our protocol, and it's been fun to see them there. We have property at Reed Communities. We have a playground and a basketball court there. So we are continuing to do the protocol that we need to allow those properties to continue to be open for our community. So we have a lot going on, even though our building is not open to full capacity. And we'll be trying to continue to do more things in the winter time, as long as you know, the directives, and we're allowed to continue in the capacity that we are, to make sure we can try to keep everybody safe.
Tremendous. Thank you for all you do for the community, and certainly for everyone's mental health at this point and well-being during this time. Thanks a lot, Sue.
You're welcome. Thank you for having us.
Next, I'd like to introduce Linda Loring, who is a local resident of Kingston, long time. She is a member of the Unitarian Universalist Church here in Kingston. She also is a member of Moms Demand Action Against Gun Violence, as well as Grandmothers Against Gun Violence. And she has a very important project to tell us about, which is called the Soul Box Project. So Linda, welcome. Thank you. It's very nice to have you here.
Thank you so much for having me. And it is such an important topic for us to be aware of, because gun violence, unfortunately, at the time of this pandemic, is on the rise. And the number of guns that are being sold is incredibly on the rise. And therefore, the statistics, they're going to play out. They know how these things go. And the access to guns is just going to be so much greater than it ever was before. And that's the concern. You know, the organizations I belong to are very, very interested in making sure that people who own guns are responsible about it. And that's huge. But the project that I got involved in has been started by an artist who said, there's even more than legislation that's involved here. We need to reach people emotionally. And one way to do that is through art. Okay, so she came up with the idea of making these 3-inch origami folded boxes and then decorating them in a way that will draw your attention to this pandemic. It's really a pandemic in our country, because there's over 36,000 deaths each year in this country from guns. In the state of Massachusetts, it can be around 250 each year, and we're very fortunate in Massachusetts to live in a state that has very strict gun laws, and therefore very, very low deaths comparatively with the rest of the country. We're one of the lowest states in the country, gun death wise. And that's awesome, but there's always more that can be done, because one is too many. One gun death is too many. But
So
when we look
tell
at
us what you did for the project here in Kingston.
After I was introduced to it and met up with this Leslie Lee who started this, I got some of the folks at my church involved. There's probably at least 15 or 20 of us who have been folding boxes and creating them with just wonderful plain boxes to hold the space for unnamed victims. Some of them have names on them for named victims, and others have messages on them. And the messages can be sad, they can be angry, and they can be hopeful. And really, there's a wonderful array of messages on these boxes.
And how many have you made to contribute to the national project?
We have sent off 1,383, and they were just received a few days ago. And they will go into the panels and into the bags that will be used in the exhibit in Washington, D.C. Right now it's scheduled for March. It's already been put off once. May have to be put off again, because this is an exhibit they really want to draw crowds of people into. They want people to have a chance to see the visual effect of these kind of numbers happening each day. We have 100 in backpacks. We can show 100 boxes representing 1 day's worth of gun deaths in this country in a little
What other
backpack.
takeaways do you think people should take from this project, along with the number of deaths?
Yeah, the number of deaths, which is so remarkable, and what we can do about that. And one of the things we can do as individuals is make sure that if there are guns in the household, that they have been safely stored, that they're locked up, okay? That you have conversations with the kids, you know, that you have conversations about gun safety in the house, that you have conversations with the families where your children are visiting. That too. And then also the fact that there are 61% of the gun deaths in this country are suicides. And that was the biggest takeaway. It was such a shocker for me. I had no idea. You know, you hear of the mass shootings and you think but that's just the tip of the iceberg, you know. But these suicides, it's so important to talk to people, you know, are despondent and depressed, and be there for them. And that's another takeaway, you know, as well as calling your legislatures or sending, you know, emails and so forth about legislation you believe they need to be supporting. But there's just so much we can do, you know, as individuals.
Exactly. Well, thank you. This is a tremendous project. We will have the website where you can look and see what they're doing nationally. And we'll also have information about the groups that Linda belongs to: Moms Demand Action Against Gun Violence, Grandmothers Against Gun Violence, as well as suicide prevention. So again, Linda, thank you so much for introducing us all to this wonderful project. We'll be on the lookout for it nationally.
Thank you, Janet. Thank you for giving me a chance to say that one person can make a difference folding one box.
Absolutely. Okay. Bye-bye.